We have 6 new antenatal and newborn screening programmes, and they're kind of separated into 3 antenatal programmes and 3 newborn programmes. Sickle cell and thalassemia affect people from certain ethnic backgrounds. If the mother is a carrier of sickle cell or thalassemia, then there's a potential for the baby to also be a carrier, which isn't a problem in itself. But if the dad is also a carrier, there's the potential for the baby to actually have the condition. So what we do is we like to test mum first of all. We fill out a form at booking called a family origin questionnaire. So the midwife asks what their ethnic background is. We'll fill in that form. Depending on what boxes are ticked on that form will depend on whether we do the test or the full test or not. If mum comes back and it shows that mum is a carrier of a sickle cell or a thalassemia, then that's when I would get in touch with the mum and talk to her about testing dad. So we like to test baby's dad, and then if he's also a carrier, there is the potential that the baby could have the condition, in which case we would talk to them about further testing that we can do for the baby to see if the baby has the condition, and then we can offer further tests from there. These are 3 chromosomal abnormalities. They're the 3 most common chromosomal abnormalities that a baby might have. And what we can do is we can test for those around about between sort of 11 weeks and 1 day of pregnancy and 14 weeks and 1 day. And we generally try to do it around about 12 weeks. And that test is what's called a combined screening test. So we do a scan and we look at the fold of skin at the back of baby's neck, which is called a nuchal translucency. That fold of skin, babies that have Down syndrome, Edwards or Patau syndrome, very often that fold of skin will be increased. It's also increased sometimes if babies have a heart condition, so sometimes we can pick up heart conditions if we have an increased nuchal as well. Then what we do, because it's a combined screen, we take some blood from mum. So the blood test is looking for a hormone in mum's blood and a protein that comes from the placenta, which is in mum's blood. We put that all together with things like mum's age, weight, whether she smokes, whether she's diabetic, family origins, all of these things go together, and we work out a risk factor for the baby having Down syndrome, Edwards or Patau syndrome. So this doesn't say that baby's got any of those conditions, it just says what the risk factor is. And then if someone came back as a high risk for having one of those conditions, then I would contact the lady and discuss the high risk with her, and again discuss some further testing options to find out whether the baby has those conditions, if that's what mum wants to do, mum and dad want to do. The other test that we do is looking for 3 infectious diseases in pregnancy, and those are HIV, hepatitis B and syphilis. And the reason we offer this screening is, first of all, if mum has any of those conditions, the quicker we get mum on some treatment, the better for her and for her well-being. And obviously these conditions can be passed on to baby, and we can reduce that so that those conditions aren't passed on to baby. So for example, for HIV, if a mum's HIV positive and we know about it during pregnancy, and mum has the correct treatment during pregnancy, we can reduce the chances of baby contracting HIV to 0.27%. So that's a really, really small chance that the baby would get HIV. There's the newborn hearing screening. The girls will come round when you're in the hospital and ask if you want to have the hearing screening done. And they just put the little probes near baby's ear and they do the hearing screen from there. So it's quite harmless. Your babies sort of, don't notice. They're usually sleeping when they have it done and wouldn't kind of notice that they were having that test done. That would pick up sort of permanent hearing loss for babies. And And obviously the sooner that we have that test done, the better, you know, because then we can get sort of, if babies needed to have hearing aids and things like that, then we can get them sooner rather than later, which is better for babies' speech and language and development and things. Newborn infant physical examination is like a top to toe examination of baby. We check things like their eyes, hips, heart. If it's a little boy, we check his testes to make sure that they're in the right place. You know, we just have a general kind of check to see that everything is okay with baby. Obviously things like if we feel that there is a problem, sometimes babies have what's called a clicky hip, so the hips are just a little bit of a click, then we would refer them on to have a scan and maybe to see the orthopaedic team. Again, we check babies' hearts to see if there's any murmurs or anything like that there, but it is just basically like a little MOT for baby. The newborn blood spot is just a little sample of blood that's taken from the baby's heel on day 5. That is testing for some metabolic conditions. There's 9 conditions altogether. So there's 5 metabolic conditions, which are conditions that if they went undetected, they can sort of build up. There's, you know, baby can't break down certain substances in their body if they've got these conditions, which are very rare, and it means that these substances would build up in baby's body and sometimes can cause quite severe problems. But again, if we find out about it now when baby's small, before these products have had time to build up, then you know, we can prevent any harm to baby. And then we test for things like sickle cell anemia, and we test for congenital hypothyroid. So these are just conditions that, again, they're things that, you know, we could probably pick up later on in baby's life, but that would be once baby's starting to show symptoms of the condition. Whereas if we can find out at birth that baby's got these conditions, we can take actions and we can kind of try and prevent, you know, anything, you know, any problems from the conditions.